All right, let's get right into it. Today, we're going deep inside the human body. I mean, really deep, to talk about a pretty serious and often hidden threat. We're talking about a war that can be waged within our own framework, an infection that attacks our very bones and joints.
You know, we tend to think of our skeleton as this amazing, strong, supportive structure, right? And for the most part, it absolutely is. But what happens when the enemy isn't something from the outside, but an invader that's already inside? Well, it turns out our bones and joints can be, believe it or not, really vulnerable to a direct and pretty devastating attack.
And look, the stakes here could not be higher. We're not talking about a minor inconvenience. The potential outcomes are, well, they're severe. We're looking at things like sepsis, the complete destruction of a joint, chronic pain, even lifelong disability. This is one of those battles our body just cannot afford to lose.
So, here's our game plan for today. We're going to break down the two main fronts of this internal war: the joint attack, septic arthritis, and the bone breach, osteomyelitis. Then we'll cover the path to recovery, and, finally, talk about why acting fast is absolutely everything in this fight.
All right, first things first. We have to understand the battlefield itself. We're dealing with two really distinct, but related, types of infections that can dig in deep inside our musculoskeletal system. So let's just break it down nice and simple. On one side, you've got septic arthritis. Think of that as an infection of the joint. On the other side, you have osteomyelitis, which is an infection of the bone itself. Two different targets, but yeah, both are incredibly serious. Okay, let's tackle our first front, the attack on our joints. We're talking about septic arthritis, an infection that goes right after some of our most mobile and important parts. So what exactly is it? Well, septic arthritis is basically an infection that gets into the fluid and tissues of a joint. Now, it can technically happen anywhere, but the number one target is the knee. After that, you're looking at other big joints, like our wrists, ankles, and hips.
Which, of course, brings up the next big question. So, who are the culprits here? Who are these microscopic invaders responsible for launching this whole attack?
Well, the main perpetrator, kind of the prime suspect across almost every age group, is a bacteria you've probably heard of, Staphylococcus aureus, or just S. aureus for short. But it's definitely not a solo act. Other bacteria like Neisseria gonorrhea and various kinds of streptococcal species are also pretty common causes.
And this is where it gets really interesting. The most likely bacterial culprit actually changes depending on how old the patient is. For little tiny infants under 3 months old, doctors are looking for things like group B strep. For toddlers, it could be a totally different bug. And then for older kids and adults, the list gets even bigger. This is so important because it helps doctors make an educated guess on the best initial treatment, sometimes long before the lab results even come back.
So, are some people more at risk? Absolutely. The risk is definitely highest at the extremes of age, so we're talking about the very young and the elderly. But there's a whole list of other things, like having inflammatory joint disease, diabetes, a weakened immune system. Even something as simple as a recent injury or an injection into a joint can kind of open the door for these infections to get in.
Okay, so this is the point I really want to hammer home, especially when we're talking about kids. Septic arthritis is considered a true clinical emergency. I mean, any delay in diagnosing it can lead to, well, the source material calls them disastrous complications. And they're not kidding. We're talking about the complete destruction of cartilage, damage to growth plates, permanent dislocation. Time is absolutely everything here.
So while that urgent battle is raging inside the joints, there's an equally dangerous war that can be fought on a completely different front. Let's shift gears now and talk about the infection that goes even deeper, the one that breaches the defenses of the bone itself. This is osteomyelitis.
So, osteomyelitis. What is it? Put simply, it's an infection of the bone. And one of the first and most important things doctors figure out is whether it's acute, meaning it pops up pretty quickly over a few days or weeks, or if it's chronic, which means it's a stubborn, long-standing infection that can hang around for months or even years.
And you can really see the difference here. The acute form shows up how you'd probably expect, with fever and pain right over the area. But the chronic form, that's a bit more sneaky. Its classic sign is the presence of something called a sequestrum, and all that is a piece of dead bone that the infection has kind of walled off from the rest of the body. So you're probably wondering, how does the bacteria even get into the bone in the first place? Well, think of it like two main highways. The first is through the bloodstream. Bacteria just travel along until they find a good spot in the bone to settle down and start causing trouble. The other route is more direct.
where the infection just spreads from a nearby infected area, or it gets in through a cut, a surgery, or even an injection.
To figure out what's going on, doctors basically launch a full-scale investigation. It almost always starts with a simple X-ray, but they'll also do blood cultures to see if they can catch the bacteria red-handed in the bloodstream, and they'll check for inflammatory markers. These are basically signals that the body's alarm system is going off because of a major infection.
But the one test that's considered the absolute, undisputed gold standard is a bone biopsy. That means they actually take a tiny sample of the bone itself to look at under a microscope and grow in the lab. It is, without a doubt, the most direct way to positively ID the enemy.
Okay, so we know who the enemy is, and we know how doctors find them. So now, let's talk about the counterattack. How do they actually fight back and win this thing?
The treatment is basically a powerful, multi-pronged attack. First, and this is critical, they have to drain the infection. That might mean using a needle to draw out fluid, or it could mean actual surgery to go in and clean things out. At the same time, they hit you with a heavy-duty course of antibiotics. They start broad, and then they narrow it down once they know exactly what bug they're fighting. And finally, especially for those really stubborn chronic cases, there's often surgery to physically go in and remove any abscesses and that dead bone, that sequester we talked about.
And all of this really brings us to the most important point, the one thing that connects both of these infections. It is an absolute race against time.
So let's wrap this all up. What's the bottom line? Both of these infections are incredibly serious, and they can cause permanent, life-altering damage. Remember, septic arthritis, especially in a child, is a flat-out medical emergency. And osteomyelitis can turn into this nasty, chronic problem if it's not dealt with quickly. In both cases, the key to winning is exactly the same. Diagnose it fast and hit it hard with that 1-2 punch of drainage and the right antibiotics.
And that kind of leaves us with one last question to think about. When you consider just how devastating these infections can be, and the fact that they're happening deep inside of us, totally hidden from view, are we really aware enough of the signs? Do we truly understand the absolute urgency they demand?